If you think you're cleaning yourself properly after using the bathroom, prepare for a shock. The method that 95% of people use daily not only fails to clean adequately, it is literally causing and worsening hemorrhoids, fissures, infections, and a host of problems that could be completely avoided. And the most disturbing part? You probably learned this wrong method as a child and never questioned it. In a random bathroom, Zhao finishes his bowel movement and automatically grabs toilet paper, rubbing vigorously until the paper looks clean. Without realizing, he is creating micro-lesions that will turn into painful hemorrhoids. In the bathroom next door, Maria uses perfumed wet wipes, thinking she's being more hygienic, ignoring that the chemicals are destroying her natural protective flora. At home, Pedro takes pride in his impeccable hygiene by using excessive amounts of antibacterial soap, not knowing he is creating the perfect environment for resistant infections. 3 well-intentioned people, 3 seemingly hygienic methods, 3 guaranteed ways to develop serious anal problems. Today, you will discover why almost everything you learned about intimate hygiene is wrong, and more importantly, the correct method that proctologists personally use but rarely teach. If you suffer from constant irritation, itching that never improves, recurring hemorrhoids, or simply want to prevent future problems, this video contains information that should be taught in every school but remains taboo. Subscribe immediately and turn on all notifications. We break taboos every week and reveal medical truths that can prevent years of unnecessary suffering. The biggest mistake 95% of people make is believing that cleaning means scrubbing until the paper comes out completely white. This obsession with clean paper is destroying millions of anuses every day. Let's understand why this is biologically incorrect and extremely harmful. Anal skin is different from any other skin on the body. It is a transition mucosa, extremely thin, rich in nerve endings and superficial blood vessels. When you repeatedly rub dry paper, you are literally sanding this delicate mucosa. Each wipe removes not only waste, but also the natural protective layer of mucus and oils. Microscopically, what happens is terrifying. Toilet paper, even the soft kind, has rough fibers that create micro-scratches. These scratches are open doors for bacteria. But worse, the act of scrubbing pushes fecal particles into these microscopic cuts. You are literally infecting yourself. The pursuit of white paper ignores biological reality. There will always be microscopic residues in the anal crypts, tiny natural folds of the mucosa. Trying to remove 100% is impossible with dry paper, and the attempt causes damage disproportionate to the benefit. It's like trying to clean grease off your hands using only paper. You would scrub until you bled. Studies show that people who use more than 5 sheets per cleaning are 3 times more likely to develop hemorrhoids. The repeated friction inflames the hemorrhoidal plexus. Each bathroom visit adds inflammation. In a matter of months or years, hemorrhoids are inevitable. Bleached toilet paper adds chemical insult to mechanical injury. Chlorine, dioxins, and other bleaching chemicals remain in the paper. Applied to irritated mucosa, they are absorbed directly. Many allergies and chronic irritations are actually reactions to the chemicals in the paper. The pressure applied during vigorous cleaning can exceed 2 kilograms per square centimeter. For delicate tissue already vulnerable after a bowel movement, this is significant trauma. Blood vessels rupture, nerves become irritated, inflammation sets in, all because of the obsession with clean paper. Worse still, the more you scrub, the irritated and dirty the area seems. Irritation causes defensive mucus secretion that sticks to the paper, making it look like it's still dirty. This leads to more scrubbing, more irritation, a vicious cycle that only ends with serious problems. Many believe that wet wipes are the superior solution. After all, they're soft and clean better. The reality is, they can be even worse than dry paper, creating problems that take years to resolve. First, the chemical composition of wipes is alarming. Even the gentle or for babies types contain propylene glycol, a known irritant, parabens, hormone disruptors, synthetic fragrances, potent allergens, alcohol, extreme drying. You are applying a chemical cocktail to your most sensitive mucosa. Flushable is the biggest lie in modern marketing. These wipes do not dissolve like toilet paper. They clog pipes, costing billions in sanitation damage. But worse, if they don't dissolve in water, imagine what the chemicals that keep them intact do to your skin. The sensation of freshness is misleading. It's caused by alcohol and menthol evaporating, creating artificial cooling. But this evaporation drastically dries out the mucosa. Dry skin cracks, itches, inflames. The momentary freshness comes at a high cost in irritation. Wipes create chemical dependence. The chemicals destroy the skin's natural barrier. Without protection, the area becomes more sensitive, requiring more wipes for relief. It's a lucrative, vicious cycle for manufacturers, destructive for consumers. Contact dermatitis from wet wipes is an unreported epidemic. Redness, intense itching, peeling, symptoms people attribute to hemorrhoids, but are actually allergic reactions. Stopping wipes resolves symptoms in days, but damage to the skin barrier can take months to recover. The pH of wipes is rarely appropriate for the anal region. Anal mucosa has a slightly acidic pH, 5.5 to 6.5, that protects against pathogens. Alkaline wipes destroy this balance, allowing harmful bacteria and fungi like Candida to grow. Preservatives necessary to keep wipes fresh are particularly problematic. Methylisothiazolinone, MI, and methylchloroisothiazolinone, MCI, are allergens so potent they've been banned from many cosmetics, but remain in intimate wipes. The belief that the more soap, the cleaner, is creating an epidemic of anal problems. Too much soap, or the wrong type, is often worse than using nothing at all. Antibacterial soaps are the worst offenders. Triclosan and similar agents don't discriminate between good and bad bacteria. The anal region has a specific protective microbiome. Destroying it with antibacterials leaves the field open wide for opportunistic pathogens. It's like burning down a forest to plant crops. You destroy the entire ecosystem. The pH of common soap, 9 to 10, is brutally alkaline for anal mucosa. Each wash destroys the protective acid mantle. Without this protection, fungi thrive, pathogenic bacteria settle, chronic irritation develops. Many cases of hemorrhoids are actually soap-induced dermatitis. Fragrances in intimate soaps are ironically inappropriate. The more pleasant smelling, the more irritating chemicals they contain. Linalool, limonene, citronelle, pretty names, but potent allergens. Applied to sensitive mucosa, they cause immediate inflammation and long-term sensitization. Sodium lauryl sulfate, SLS, a common foaming agent, is an industrial detergent that removes all protective oils. Completely de-oiled skin becomes vulnerable, dry, and prone to fissures. It's like removing all the oil from a car engine. It works briefly, then breaks down. Moisturizing soaps often make the situation worse. Excess glycerin can paradoxically dry out the skin. It's a humectant that pulls water. Mineral oils, petroleum-derived, create a film that blocks cellular respiration. Silicones seal irritants against the skin. Excessive frequency is an overlooked problem. Washing the anal region with soap after every bowel movement completely destroys natural barriers. Once a day during a shower is the maximum recommended. More than that is unnecessary chemical aggression.
Now that you understand the mistakes, let's move on to the correct method, used by proctologists and professionals who truly understand anal anatomy and physiology. It's simple, effective, and prevents virtually all problems. First, and most important, Water is the primary cleaning agent. Toilet paper should only be used for drying, never for scrubbing. If you had feces on your arm, would you scrub with dry paper until it came off? Of course not. You'd use water. Why should the anus be any different? The ideal technique: after a bowel movement, use paper only to remove superficial excess with a gentle touch without scrubbing. Then rinse with lukewarm water, not hot, not cold. A bidet is ideal, but alternatives work: handheld sprayer, peri bottle, even a cup of water. Water direction matters. Always front to back in women to prevent urinary infection. Gentle circular in men. Pressure should be soft. It's not a pressure washer, it's a rinse. Imagine washing a baby. That's the delicacy required. Proper drying is crucial. Soft paper, or ideally a designated cotton towel, washed frequently. Do not scrub. Just gently press to absorb moisture. A dabbing motion, not a wiping. Each touch should be soft, with no friction. If water is unavailable, public restroom. Use the minimal damage technique. Slightly moisten paper with sink water. Never scrub, always gentle touches from outside in. As few passes as possible. Complete proper cleaning with water once at home. Soap, when necessary, must be neutral, pH 5.5 to 6.5. Fragrance-free, dye-free, use the minimum amount, half a pump, or light foam from a bar. Apply with your hand, not a sponge or cloth. Rinse thoroughly. Soap residue irritates more than dirt. Post-cleaning, if skin is dry or irritated, a small amount of coconut oil or pure petroleum jelly creates a protective barrier. Apply with a clean finger in a rice grain-sized amount. It's not gross, it's smart care for delicate tissue. We don't always have ideal conditions. Knowing how to adapt the correct method to different situations is essential for maintaining anal health anywhere. Public restrooms are a common challenge. Carrying a small squeeze bottle with water is a discreet solution. Or baby wipes without fragrance for emergencies. Never flush them. Slightly moistened paper towel from the sink is better than dry toilet paper. Creativity saves mucosa. During menstruation, extra care is needed. Menstrual blood can irritate anal skin. Pad changes should include gentle water cleansing of the entire area. Avoid mentholated or refreshing products that worsen sensitivity. Postpartum requires a special protocol. The area is extremely sensitive, possibly with stitches, and hemorrhoids are common. A pali bottle is essential. Lukewarm water with a pinch of salt can help healing. Drying with a hairdryer on cool avoids touching painful tissue. Long trips, plane, bus, limit options. Use alcohol and fragrance-free intimate wipes for the bare minimum. Carry a water bottle for a portable bidet. Prioritize hydration to avoid constipation, which worsens everything. Elderly or mobility-limited individuals need creative solutions. An electronic bidet is a worthy investment. Handheld sprayer extensions make reaching easier. Strategic mirrors help visualization. Dignity and autonomy are possible with the right tools. Children should learn the correct method early. Make it fun. Time to wash your bum, instead of trauma with paper. Wipes only for drying. Avoid creating an obsession with perfectly clean. Early education prevents decades of problems. Ostomy patients have unique challenges with peristomal skin. Water is always better than chemicals. Use specific skin protectors. Never scrub the area. Consult an ostomy nurse for tailored techniques. Quality of life depends on proper care. Investing in the right tools makes it easier to maintain proper hygiene. These aren't luxuries, they're health investments that prevent future treatment costs. Bidet is the gold standard. Seat versions, $200 to $500, can be installed on any toilet. Temperature-controlled water, adjustable pressure. It pays for itself in paper savings and problem prevention. Countries with bidets have drastically lower incidence of hemorrhoids. Handheld sprayer is an excellent affordable alternative, $50 to $150. Easy installation, manual control for precision. Also useful for cleaning the toilet and other uses. Choose a model with pressure regulator to avoid jets that are too strong. Perry bottle, $10 to $30, a mobile solution. The design allows correct reach, useful for travel, work, any situation outside home. Discreet in a bag or backpack. Wash well after each use, dry completely. Toilet paper, if necessary, should be unbleached, fragrance-free, maximally soft. Eco brands are generally better, fewer chemicals. Bamboo is better than eucalyptus, which is better than pine. Investing in quality prevents irritation. Specific cotton towels like cloth diapers are superior for drying. Washable, reusable, soft. Having 7 to 10 allows hygienic rotation. Wash in hot water, sun-dry when possible. More economical and eco-friendly long-term. Ideal soap? Syndets, mild synthetic detergents, pH balanced, dermatological brands for sensitive skin, free of fragrance, dyes, parabens, sulfates. Simple is better. Expensive at first, but lasts long. You use very little. Barrier protectants, ointments, pure petrolatum, zinc oxide, anhydrous lanolin. Create protective film before challenging situations like diarrhea or travel. Use minimal amounts and remove completely afterward. Now are you realizing that practically everything you learned about intimate hygiene was wrong? These revelations have already changed the lives of thousands who thought they were just too sensitive. Keep going. We still have much more to reveal. Leave a like if you're shocked by how many mistakes we make daily. Help this vital information reach those who need it. The damage from improper cleaning goes beyond momentary discomfort. Years of inadequate hygiene create chronic problems people don't even associate with cleaning methods. Anal pruritus, chronic itching, affects 5% of the population. Most cases due to overcleaning. The more it itches, the more they clean. The more they clean, the more they irritate. The more they irritate, the more it itches. A vicious cycle that can last years until the real cause is identified: excessive hygiene. Anal fissures often start with rough toilet paper. A small initial cut worsens with daily vigorous cleaning. Defensive muscle spasm prevents healing. Each bowel movement reopens the wound. Extreme pain leads to constipation out of fear, making everything worse. Chronic perianal dermatitis is diagnosed as eczema, but often as a reaction to hygiene products. Red, scaly, painful skin. Treated with corticosteroids that thin the skin further. The real problem, the cleaning method, is never addressed. Fungal infections thrive in the environment created by improper cleaning. Alkaline soaps destroy the protective acidic pH. Moisture from poorly dried wipes creates the perfect environment. Candida and other fungi take hold. Itching worsens, leading to more cleaning, perpetuating infection. Hemorrhoids are drastically worsened by daily mechanical trauma. Already dilated veins are scrubbed with rough paper. Inflammation has no chance to heal. Bleeding leads to more vigorous cleaning to ensure hygiene. A downward spiral until inevitable surgery. Anal stenosis, narrowing, can result from chronic scarring. Repeated fissures, constant inflammation, scar tissue builds up. The anal canal progressively narrows. Difficult bowel movements lead to more straining, more trauma, more scarring. Paradoxical incontinence. The sphincter muscle, constantly irritated, loses tone. Small leaks lead to even more obsessive cleaning. More irritation, less control. The muscle problem is treated as lack of hygiene, worsening the situation. Impaired sexuality is an unspoken consequence. Chronic pain, constant irritation, and shame of not being clean destroy libido. Anal sex becomes unthinkable. Relationships suffer. Quality of life plummets, all because of toilet paper.
The biggest barrier to proper hygiene is cultural taboos and unfounded fears. Let's destroy the myths that keep millions suffering unnecessarily. Using water is unhygienic, the exact opposite of the truth. Water removes bacteria better than dry paper. Hospitals wash wounds with saline. They don't scrub with dry gauze. Why should the anus be any different? Cultures that use water have fewer anal problems. I'll spread bacteria. The correct technique prevents this. Directed water, no direct hand contact with feces. Wash your hands afterwards as you always should. Much more hygienic than paper that pushes bacteria into the skin. It's gross to touch. More gross is living with chronic irritation. Your hand washes other parts of the body. Why discriminate? With water and proper soap, it's as hygienic as any other procedure. It takes too long. Proper cleaning takes less time than obsessively scrubbing with paper. 30 seconds with water versus 5 minutes chasing white paper. Simple math. Bidet is for the rich. A plastic water bottle works perfectly. Cheap adapters exist. Bidet investment pays for itself in paper savings and medical treatments. Misplaced priorities keep people suffering. A real man doesn't use that nonsense. A real man isn't afraid to care for his health. Toxic masculinity that associates suffering with strength is ridiculous. Hemorrhoids don't respect machismo. It's immodest. Is modesty suffering silently from preventable problems? Taking care of your body is an act of self-respect. False modesty keeps people suffering and the pharmaceutical industry profiting. Changing lifelong habits requires strategy. Gradual implementation ensures lasting success without overwhelm. Week 1. Awareness. Simply observe your current habits without judgment. How many sheets do you use? How much pressure do you apply? How long does it take? Awareness is the first step to change. Week 2. Harm reduction. Continue your current method with modifications. Less pressure, fewer sheets, softer paper. Slightly moisten paper if possible. Small adjustments, big difference. Week 3. Introduce partial water use. After cleaning with paper, finish with water. It can be a sprayer, bottle, whatever is available. Feel the difference between real versus superficial cleanliness. Week 4. Reverse the process. Use water first, paper only to dry. Notice the drastic reduction in paper used. Savings already visible. Month 2. Refine technique. Experiment with water temperatures, pressures, angles. Find what works best for your anatomy. Every body is unique. Month 3. Establish the complete routine. Water, gentle drying, protection if needed. As natural as brushing your teeth. Previous problems are likely improving significantly. Handling family resistance. Educate gently. Share information, don't force. Your example of improved health speaks louder than words. Bathroom changes benefit everyone. Even with perfect hygiene, some problems require medical attention. Knowing when to seek help prevents complications. Bleeding that doesn't improve within a week using the correct method deserves investigation. It could be a deep fissure, internal hemorrhoid, or rarely something more serious. Don't ignore it out of shame. Pain disproportionate to gentle touch suggests infection, abscess, complicated fissure. Early treatment prevents complications. Proctologists have seen it all. There's no reason for shame. Skin changes, warts, spots, lesions that don't heal. They may be benign but require evaluation. Anal HPV is common and treatable. Early detection is crucial. New or worsening incontinence, gas, liquids, feces. It's not just age. Effective treatments exist. pelvic floor therapy works wonders. Quality of life can be restored. Itching that persists despite proper hygiene may indicate parasites, diabetes, liver disease. Proper investigation identifies treatable causes. Don't suffer assuming it's just irritation. Choosing a professional, proctologist or colorectal specialist. Avoid those who dismiss complaints or fail to explain properly. A good professional educates, not just medicates. A second opinion is always valid. Individual change matters, but cultural change is transformative. Each person who adopts proper hygiene can influence dozens. Proper childhood education. Teach without creating trauma or obsessions. Water cleans better is a simple concept. Normalize complete body care. Prevent decades of future problems. Talk openly when appropriate. Sharing knowledge saves others from suffering. Breaking taboos benefits everyone. Humor helps. Everyone has an anus. Everyone needs to clean. Push for structural changes. Bidets in public restrooms, higher quality paper, education in schools. Developed countries clinging to outdated practices due to cultural taboo need to evolve. Health professionals have a special responsibility. Proactively educate, don't just wait for problems. Include anal hygiene in routine checkups. Demystify, normalize, prevent. Media can help. Documentaries, articles, influencers speaking openly. The more it's talked about, the less taboo. Less taboo, less suffering. A virtuous cycle of information. Industry must take responsibility. Stop misleading marketing of flushable wipes. Reduce chemicals in products. Create truly safe options. Informed consumers force change. We've reached the end of this transformative revelation, but for you, it's only the beginning of a life free from problems caused by improper hygiene. The mistake you used to make, vigorously scrubbing until the paper came out clean, is no longer an unconscious habit. It's a choice you can change immediately. You discovered that practically everything taught about intimate cleaning was wrong. Dry paper is inadequate. Wet wipes are chemical bombs. Excess soap destroys natural protections, but most importantly, you now know the correct, simple, and effective method. Water, gentle touch, respect for delicate tissue. It's not complicated, it's not time-consuming, it's not unhygienic, it's simply correct. Millions around the world have been doing this for centuries. Now you join them, leaving unnecessary suffering behind. Imagine never again having irritation after using the bathroom, chronic itching becoming a distant memory, hemorrhoids finally having a chance to heal, fissures closing permanently. This is your new reality. Accept it with gratitude. If this knowledge has revolutionized your understanding of intimate hygiene, urgently spread it. Subscribe now and activate all notifications. Next week we'll reveal the 7 types of anal itching and what each means for your health. It's medical knowledge that can identify serious problems early. Show with a like that you're committed to never making this fundamental mistake again. Every like helps this taboo yet vital information break through the algorithm and reach people who've been suffering for years without knowing the cause. Be part of the conscious hygiene revolution. And now declare your change. Comment water if you'll adopt the correct method. Never again if you're shocked by the mistakes you used to make. Your public declaration inspires others to question destructive habits. Together, we break the taboos that keep millions suffering. On your next bathroom visit, everything changes. No more violence against delicate tissue. No more irritating chemicals. No more obsession with white paper. Just real, gentle, and respectful cleaning. Small change, profound impact. Life without irritation, without itching, without pain. Your personal hygiene revolution begins the next time you sit on the toilet. Do it differently. Do it correctly. Do it with knowledge. The future is clean, gentle,
and healthy. And it starts now.